One.
Hi there. Thanks again, Bridget and Butch and Ed. You guys are the best. I'm going to try to show you what we're doing for the Radicava treatments. These are the supplies that you're going to need. I'm just going to label what they are. First of all, this is the tube that the Radicava is going to be connected to, and then it'll be connected to his chest port. This is saline solution. This is alcohol. This is the medication itself, Radicava. The most important thing they want you to do is when you open the package, you should see pink, which indicates that this is fresh and good quality Radicava. So you want to make sure that they both are pink. So that's great. This is saline solution and alcohol. This is heparin, and alcohol. So what we're going to do is, the first thing I do is make sure that your hands are washed, which I did wash my hands, because you want it to try to be a sterile procedure. You're going to peel this back. And here we have the Radicava. What it has is a little plastic tab. I'm going to take that plastic tab off. And I'm going to inject this into the plastic tab. I have plenty of these in the drawer in here. I have saline, heparin. I have everything you need. Alcohol wipes. So we'll shut that. So I'm going to tear this tab off. It's pretty easy. I'm going to turn this up, and I'm going to push it in and turn it a little bit. So now we're pretty much ready to rock and roll. So I'm going to bring this over and hang it up. Sometimes I just hang the bag and then I stick it in. So that's another option too. Maybe I'll show that to you on the second round. Okay, so we've got this. What'd you say? Oh, the clamp. Oh no, it's not started yet, honey. So that's the other thing is we want to clamp. Well, we don't want to clamp this. We want it to stay open for a minute because we want the medication to come out of it. We're going to prime the pump and then let this come all the way through. And as soon as it gets to the end, we're going to clip it. It was a little loose. So we're going to take this. We're going to turn it to 200. It's clamped right now, but when we connect it to John, it'll come out 200 droplets. You can do 250 at times if you want, but start out at 200. Okay. Or I'm going to just do that right like that right now. We're going to unbutton John's shirt. Hi, John. Hubba hubba.
Looking good, Johnny boy.
And here is his, what do we call that? I can't remember.
Chest port.
Yeah, it's a chest port, but this little thing is, you take the plastic off.
Of what is that?
This is a saline syringe. And you want to just get the air out of it. Ooh, and that's okay if it squirts.
John likes it.
Well, it's better that... And you want to take out your alcohol wipe. And it's really important to clean around it. So I usually count to 15. And then I count to 15 this way. This is my first solo experience with the chest port. We're going to put this on. And one of the most important things that the new nurse showed me yesterday, which is they want you to push a little saline into John and then draw back and make sure you see a little bit of pink or red right here. And that's just to make sure that the line is connected properly. So we're going to we're going to pull back and hopefully a little bit of red will come out. Oh, yep. Yay! So we're going to do steady pressure and just push that saline in. It's really pretty easy.
Does that hurt, John?
No, I'm sorry my nipples on.
Oh, he doesn't want to turn anybody on. Okay, now we're going to take this cord and basically we're going to just screw this on.
And this is the cord to the Radicava.
Yes, and then I'm going to unclamp it over there.
Come on over, Nellie, around my back. You see.
You unclamp it. And then you just want to make sure it's at 200. Again, you can sometimes do it at 250 if it's going slow, but it's going to ride through here. And don't be nervous about the tiny air bubbles. That's okay. It worried me, but it's okay. They told me not to worry about it. So, he's good. This is going to take probably 30 minutes. Maybe 35 minutes, and then what I'm going to do is change the bag. I'm going to just take the other bag and hang it up there and plug that in, but we'll show you. And just make sure your hands are washed. That's one of the most important things. Yay!